A very good evening to all the students out over there. Now, students, this is Dr. Rohit Singh. I'm an associate professor for the Department of Pharmacology at Malarity Hospitals. Now, students, I really welcome you all for this online webinar, which is being hosted by Prakara, the Potential Realized. Now, students, the main motto of getting you all engaged into this webinar is with a very clear-cut concept of idea of making all the nursing graduates how to attempt for pharmacology. Now, nurses, you all play a very important role in the healthcare sector where prescription pattern of drugs do really play a very massive role. Now, in the profession of nursing, let me remind you all and let me really tell you a very important note. The drug therapy do matters to your patient at the end of the day. I hope you all agree with me. Now, when you nurses try to put a patient on drug therapy, it is the responsibility and the duty of a nurse more than a practicing doctor to whole and soul take care of a patient. Now, with that objective, pharmacology, which is being designed in your nursing curriculum, plays a very massive and a very instructive role. Now, most of you nursing students do really find difficult in reading and writing pharmacology when it really comes to the perspective of your examination. So now here we at Prakara are trying to make the pattern of writing quite in a simplified way by trying to help you out with certain important tips in pharmacology where you really try to overcome and you try to put in a very simplified way in your examinations so that you really try to pass out and score well in your examination. Now, students, let me start with the list of units what you nurses have in general in your curriculum. You nurses will be having very commonly the topics which cover with general pharmacology, chemotherapy, drugs acting on gastrointestinal system with respiratory drugs, drugs on both CNS and ANS systems, diuretics, very well, including cardiovascular system. Very commonly, you will be also learning about the vaccines, serums, and minerals, most of the hormonal drugs, toxicology, dermatology, which includes drugs for both ear, nose, and eye, along with skin disorders. Now, these are the list of major 10 units prescribed from Nursing Council of India. But again, students, out of all the 10 units, when you really see the weightage units, which are very routinely asked in your university exams, they consist of drugs acting on GI, respiratory, CNS and ANS drugs, very popularly drugs acting on kidneys such as diuretics, cardiovascular system drugs, hormonal drugs, drugs for skin disorders, ear, nose, and eye. Now, here for today's online webinar, I will try to emphasize in brief about each and every unit, whatever I have discussed over here. And we will try to see what are the very feasible expected questions in your examination asked and how you are really going to put it on paper with pen when you really try to attempt a university exam. Now, very commonly, students, when you come for general pharmacology, most of the nursing students find general pharmacology at most very vague and quite volatile. I do accept the fact, but still there is no option for you turning back because you have chosen this profession. So you have to do justice to this. So where in general pharmacology, very commonly you have to read about certain sources of drugs. From what all sources you get drugs, which includes plants, animals, minerals, microbial sources. Then you will be learning about different routes of administration to the patient, where you try to put a patient on enteral or oral route, including parenteral route, where students here you have to focus more on the examples of the drugs for parenteral route, examples of drugs which are meant for enteral route. Also try to remember for both enteral and parenteral route, advantages and disadvantages of route of administration, at least four points you're supposed to read. Now, when it comes to pharmacokinetics is nothing but it is all about absorption, distribution, metabolism, and excretion of drugs. Now, nurses, here you have to focus more on the definitions when it comes to absorption. Absorption of a drug is very commonly denoted as bioavailability. So here you should be very precise with the definition of bioavailability for your exam point of view. When it comes to distribution, please remember, here you should know there is something also known as redistribution of a drug, and you nurses should remember there is only one drug which undergoes redistribution, that is thiopentone sodium, when it comes to examination pattern. Similarly, in the distribution of drug, you should read something also known as plasma protein binding of a drug. What are the different proteins to which drug binds? 4 massive proteins such as albumin, alpha-1 acid glycoprotein should be remembered very commonly. Then coming to metabolism of a drug, wherein drug metabolism, you have to focus on the definition of biotransformation of a drug. There is one more definition, such as what do you mean by a pro-drug? The precursor form of a drug is known as prodrug, along with first pass metabolism. They will very commonly ask you for a very short note for 2 marks. What is a first pass effect? It is nothing but the degradation of a drug before entering into the systemic circulation is first pass effect, with morphine or lignocaine as very common examples. Then comes excretion of a drug, where you will be talking very commonly, and you have to read very commonly about what is plasma T-half very precisely. What are the examples of a drugs which undergo first order kinetics, zero order kinetics? Coming to next subset, pharmacodynamics, which is nothing but all about the mechanism of action of a drug. A drug binds to a receptor, it forms a complex, and it exhibits mechanism of action of drug. Now, students, when we talk about mechanism of action, for your exam point of view, you have to remember 4 families of receptor which are involved in mechanism. What are they? Such as G protein coupled receptor, receptors for enzymes, very commonly ion-gated receptors, at the same time receptors which are meant for DNA or gene expression. So these 4 families, for very short note and short essays, you have to remember. Then very commonly, at times they also ask you about the drug interactions. 2 or 3 examples of drug-to-drug interactions you have to remember. For example, combination of levodopa with carbidopa, combination of paracetamol with aceclofenac. Such examples you have to remember. And very importantly, from general pharmacology is adverse drug reaction. Now remember, students, you should know how to define an adverse drug reaction, which is an intended or unintended effect of a drug. Then you have to classify what are different adverse drug reactions. For example, you should remember what is teratogenicity, what is toxicity, what is drug dependence, what are side effects, and what is idiosyncrasy reaction. These are the 5 areas which you have to remember for your exam point of view. Now, when I say something about teratogenicity, if they ask you in exam, you should know what are the drugs which crosses placental barrier in a pregnant woman and they cause teratogenic effect. For example, tetracyclines, morphine, very commonly certain anti-thyroid drugs. These are all teratogenic drugs. Then comes something about therapeutic drug monitoring. TDM, you have to just by heart the definition of a TDM. Coming to therapeutic window, TDM and therapeutic window are almost all one and the same. You need not get confused. Usually definitions for these two things are asked in exam. Lethal dose 50 divided by effective dose 50 is known as therapeutic window. Coming to therapeutic drug monitoring, please remember any drug which has a narrow margin of safety, there we go for therapeutic drug monitoring, where at least 2 to 3 examples you have to remember for a drug which have narrow therapeutic monitoring. For example, lithium, which is used to treat mania, digoxin, which is used to treat very commonly congestive heart failure. At the same time, anti-epileptic drug phenytoin sodium. Such drugs have narrow therapeutic monitoring. Very well, coming to drug development and essential drug. Now, students, for drug development, you should only remember the concept of clinical trials. Please remember, there are 4 phases of clinical trials which are involved in the drug development process. Phase 1, phase 2, phase 3, phase 4. In exams, if they ask you for 2 marks, after which phase of clinical trial the drug is released into the market, your answer should be after phase 3 clinical trial. Or sometimes they can also ask you, what is post-marketing surveillance of a drug? Your answer should be phase 4 clinical trial is commonly known as post-marketing surveillance of a drug with an essential drug concept. By chance, if you get a question as, what is essential drug concept? Your answer should be any drug which is commonly used for the treatment of a disease which is restricted or native to that particular nation, then you go for essential drug concept. For example, New Zealand is devoid of snakes. So in country like New Zealand, anti-snake venoms are not essential drug. In Indian scenario, many poisonous snakes are present. So in the treatment of snake bite poisoning, there you go for anti-snake venom and poisons or seras as an essential drug. Then comes the concept of rational use of drug, wherein rational use of drugs, usually you students should stick up to what is an additive effect of a drug, what is a supra-additive effect of a drug. Please remember, additive, supra-additive effect of a drug have something to do with combined effect of drug. When you combine paracetamol with aceclofenac, or if you combine paracetamol with ibuprofen, that forms into the category of rationale of drug usage. So overall, from general pharmacology, these are some of the important tips where you try to have an overall outlook when you try to read it for your exam. Now, let's try to focus on what could be the frequently asked questions from general pharmacology. Now, myself, being an examiner for nursing students, being an evaluator at the university level for last 15 years, I have really seen very commonly this essay question very frequently asked, how to classify routes of drug administration with examples, and you are supposed to know the advantages and disadvantages of parenteral route. Now here, students, start your answer to the point. I have seen most of the nursing students writing irrelevant answers to the questions, which you have to avoid that. If routes are asked, just classify the routes. Put the heading as classification of routes of administration. Divide it into enteral, parenteral, topical. Put five examples into each category. Enteral is nothing but oral route, drugs in the form of tablets, syrups, capsules, solutions, suspensions are given by oral route. Coming to parenteral route, most of the injectables such as intravenous, intramuscular, intrathecal, intradermal, subcutaneous, so on are given by parenteral route. Now, when advantages and disadvantages are asked, please remember, for an essay question, when you try to answer, put appropriately in very good sentence formation and with a very good vocabulary, 5 advantages and disadvantages. Advantages of parenteral route include onset of action is quick, absorption or bioavailability is complete, 100%, very well, fastest action of a drug. The drug directly enters into the systemic circulation. And the 5th advantage is very commonly it is employed in unconscious and dehydrated or comatose patient. When you write disadvantages, put the heading as disadvantages and write points such as in parenteral route, it leads to painful. It can cause very commonly thrombophlebitis of injected vein. Drug cannot be reused again and again because sterile techniques are really required, and very commonly it can be quite expensive procedures, and very well parenteral route, a skilled expertise is required. That's it. 5 advantages, 5 disadvantages. If your answer is to the point, trust me, what marks you get in mathematics, full on full for right answer, that is how you can score for pharmacology. Now, next coming to expected short notes. Very well, you can get a short note from the absorption about bioavailability of a drug, how you're going to define it. Bioavailability is nothing but very commonly it is the rate at which and extent to which active concentration of drug is available from the site of administration. Now, whenever you try to look into the factors for bioavailability, students at least try to mention 5 factors for absorption or bioavailability, such as first pass effect, route of administration of a drug, very well at times enterohepatic circulation, drug-drug interaction, drug-food interaction. These 5 factors with examples you have to mention. Coming to next question, if you see, write a note on pharmacokinetic drug interaction. Pharmacokinetic interactions are nothing but pharmacokinetics. Very commonly here you have to try to specify drug-to-drug interaction and drug-food interaction. If you really try to remember, we have something known as enzyme induction and enzyme inhibition. 2 examples from enzyme inducers and 2 examples from enzyme inhibitors should be written rather than writing in detail about pharmacokinetics. Very well, if you see the next 3rd question, write a note on G protein coupled receptors. As I have told you at the starting, G protein couple receptor is one of the important family of receptor. You know, you have a signal transducing mechanism. I'm sorry, for very commonly for protein signaling mechanism. You try to put a diagram of G protein couple signal transducing mechanism, and you try to explain what are the different drugs which get connected to G protein couple receptor. Let me be very clear. When you talk about cholinergic drugs, when you come across adrenergic drugs, all these cholinergic, adrenergic drugs are the classical example which bind to G protein couple receptor. So here you have to first write what is a receptor, the definition of receptor. What do you mean by a G protein couple receptor? Put a diagrammatic representation with a transducing signal mechanism for G protein couple receptor. Then the third important point is, what are the drugs which bind to G protein couple receptors? What I told you, most of the cholinergic drugs like acetylcholine, most of the anticholinergic drugs like atropine, adrenergic drugs such as adrenaline, noradrenaline, dopamine, dobutamine, they all act by G protein coupled receptors. Next, coming to very short answers. Now, these very short answers are for 2 marks in your examination, which should be written very specific and very precise to the point, because time management is also very important for a nursing student for writing a paper in the examination. It should not be something like you keep on writing essay elaboratively. You keep on writing elaboratively short answers. No, depending upon the marks what are being allotted, you have to decide what content you are going to put on a piece of paper in the examination. Now, coming to define therapeutic index, as I told you, just answer the definition. LD50 divided by ED50 is a therapeutic index. That's it. You will get full 2 marks for that. In case if you try to remember some of the examples of therapeutic index, what I told you, lithium, digoxin, phenytoin, if you try to write those examples also, it is well and fine. Maybe sometimes if your definition is wrong, if your examples are also correct by chance, then you will try to score at least half to 1 mark in such sensitive area. Similarly, what are adverse drug reaction? Give example. Just define an ADR. Any unintended or undesirable effect of a drug is known as ADR, where you try to quote 1 or 2 examples, such as atropine causes dryness of mouth. Pilocarpine causes xerostomia, dryness of hand. That's it. Very specific examples with a very specific definition. So that is all overall summary of general pharmacology. Now, next coming to the second major unit, which encompasses of chemotherapy. Now, chemotherapy being very vast, students, it is divided into 2 major topics. One is antibiotics. The other one itself is chemotherapy. So what all you have to read under antibiotic headings, you have to read about important antibiotics such as beta-lactam antibiotics, which consist of penicillins, cephalosporins. You have the first ever discovered antibiotics, sulfonamides and cotrimoxazole. Now remember, students, cotrimoxazole is an expected question in your examination because it is a fixed dose combination of trimethoprim along with sulfamethoxazole, where this cotrimoxazole is used in the treatment of typhoid as well as in the treatment of urinary tract infections. Then comes fluoroquinolone antibiotics, where you have to read about ciprofloxacin, levofloxacin, ofloxacin, sparfloxacin, gatifloxacin. Make it a blind note Ciprofloxacin is a very important fluoroquinolone, which can be asked very commonly in your university assessment. Then coming to macrolide antibiotics. Now make a note. From macrolides, very commonly you will be asked questions such as general properties of macrolide antibiotics, and you should know how to enumerate macrolides such as streptomycin, gentamicin, amikacin, cysomycin, natilmycin. These are some of the important aminoglycoside antibiotics. Coming to macrolide antibiotics, macrolides consist of azithromycin, azithromycin, telithromycin, roxithromycin. When it comes to macrolide antibiotics, here you have to by heart the simple mechanism of action. All the macrolide antibiotics, they very commonly bind to 50S ribosomes. Aminoglycosides, tetracycline antibiotics, they very commonly bind to 30S ribosomes. Similarly, coming to broad spectrum antibiotics, if they ask you broad spectrum antibiotics, there are two broad spectrum antibiotics. One is tetracycline, the other one is chloramphenicol. We no longer use chloramphenicol, so chances of asking questions are more on tetracyclines, where you should know the mechanism of action, classification of tetracycline. Tetracyclines are very popularly known to cause adverse drug reaction. By chance, if they ask you for 2 marks, what are the adverse drug effects of tetracyclines, then you should be in a position to answer, such as tetracyclines cause yellowish discoloration of a teeth. If an expired or outdated tetracycline is given to a patient, then it can cause Fanconi-like syndrome. So this is how you try to learn very specific areas related to antibiotic. Coming to chloramphenicol, chloramphenicol is again popular. I'm really very sorry. Chloramphenicol is very popularly known to cause, what do you say, adverse drug reactions. Gray baby syndrome is caused by chloramphenicol. For specific 2 marks answer, you have to remember this point. Now, next coming to chemotherapy of UTI. Now, nurses here very commonly for short notes, they can ask you, what are the antibiotics which are used for urinary tract infection? So what are you going to do? You're first going to classify UTI. UTI can be complicated. UTI can be uncomplicated. For both complicated and uncomplicated, you have to enlist the list of antibiotics such as fluoroquinolones, cephalosporins, cotrimoxazole, including aminoglycoside antibiotics. After listing the major group of antibiotics, now you should try to subclassify the antibiotics from fluoroquinolones, norfloxacin, ciprofloxacin, gemifloxacin are popularly given. Coming to cephalosporins, cephalexin, cephalothrin, cefazolin, ceftriaxone, cefuroxime, like cephalosporins are very commonly given. Then you should be able to write what are the routes of administration of these antibiotics for UTI. Very much for uncomplicated UTI, oral antibiotics are given, whereas for complicated UTI, very commonly intravenous injection or IV infusion of these antibiotics are given. Those are the things you have to remember for chemotherapy of UTI. Now, next coming to important segment, chemotherapy itself. So here you should classically know treatment of tuberculosis, treatment of leprosy, treatment of HIV, and treatment of viral infections. Now, when we talk about treatment of tuberculosis, Now, TB, most of the time, it is an expected essay question in your examination. So you should know what are the drugs which are used for the treatment of tuberculosis. Out of first line drugs used, at least in detail, you have to read about two important drugs mechanism, adverse drug reaction. What are all the anti-tubercular drugs? Isoniazid, rifampicin, streptomycin, pyrazinamide, and ethambutol. These are the five important anti-TB drugs where you have to try to focus more on isoniazid and rifampicin because very popularly they are kept for first 2 months, then followed by next 4 months or vice versa for the treatment of TB. You should also by heart what could be expected adverse effects of isoniazid. It causes hepatotoxicity or hepatitis. Coming to rifampicin, you should always remember it causes flu-like symptoms. It causes cutaneous reaction and very commonly it causes orange discoloration of urine in a patient. So this is what you are going to learn from tuberculosis. Coming to DOTS therapy, directly observed treatment strategy. The government of India has formulated DOTS therapy for treatment of tuberculosis. In DOTS therapy, you should write about the intensive phase for first 4 months, then followed by continuation phase for next 2 months. Here again, you have to write a patient with sputum positive smear should be given isoniazid, rifampicin, pyrazinamide for first 4 months, then isoniazid and rifampicin for next 2 months. So this is how you try to strategize in writing DOTS therapy. Then coming to chemotherapy of leprosy. Now, when we talk about leprosy, there are two important drugs you have to remember from leprosy. One is dapsone, the other one is clofazimine. Out of these two drugs, students very commonly asked question can be on dapsone. Now, please remember, dapsone is used for both multibacillary as well as paucibacillary leprosy. Dapsone, you should know the mechanism where it is going to inhibit bacterial folic acid synthesis enzyme. Coming to its adverse drug reaction, popularly dapsone is known to cause hemolysis or hemolytic anemia in patients with a history of G6PD deficiency. At the same time, it is used in both paucibacillary, multibacillary leprosy. That's it. Dapsone is a prototype drug from anti-leprotic drugs. Clear? Now, sometimes they can also ask you on rifampicin. For 2 marks, if they ask you, what are the therapeutic uses of rifampicin? You should always remember, put the answer like this. Rifampicin is a first-line drug used in the treatment of pulmonary tuberculosis. Your second point will be rifampicin is also used in the treatment of leprosy. Your third point should be rifampicin is also used in the treatment of brucellosis. So at least 3 important uses if you put for rifampicin, then you will try to get full 2 on 2 marks for your examination. Similarly, when we talk the continuation of chemotherapy, treatment of fungal infections, you should know. Now, students, when you talk about antifungal drugs, please try to focus mainly on topical antifungal agents for 2 marks. They will ask you enumerate topical antifungal drugs. So your answer should be benzoic acid, undecilinic acid, sodium tolnaftate. These are some of the important topical antifungal drugs. Similarly, you also have antifungal antibiotics. So please make a point from antifungal antibiotics. You should learn only about griseofluxacin chlorofulvin. You should know what is clotrimazole. Don't get confused. I'm pronouncing it as clotrimazole. Most of you students will get confused with cotrimoxazole. That is a different. Clotrimazole is an antifungal drug, and you should also read about terbinafine. Terbinafine, griseofulvin, clotrimazole, topical antifungal agents. That's it. They are used in wide variety of tinea infection, tinea barbae, tinea capitis, tinea unguium, onychomycosis, fungal infection of nail. So these are the specific areas you should focus on. Antifungal drugs. Coming to antiviral drugs. Now, antiviral therapy is of two types. One is a retroviral, other one is a non-retroviral. Okay. Now, non-retroviral therapy is very commonly used for all the general viral infections. Retroviral therapy is absolutely used for the treatment of HIV infection. Now, students, for the treatment of HIV from antiviral, you should read something about heart therapy, HAART therapy. Make a specific point of this. Highly active retroviral therapy. Coming to only antiviral drugs, you please try to focus on the entire classification of antiviral drugs and in detail about acyclovir. Acyclovir is a very important antiviral drug where you should know its therapeutic uses. It is used for the treatment of chickenpox. It is used for the treatment of herpes simplex virus 1 and virus 2, which causes genital herpes, specifically in HIV group of patients. There you go for acyclovir. So acyclovir should be read in detail from antiviral, and heart therapy should be focused very commonly from HIV group of antiviral drugs. Now, similarly, coming to drugs for certain protozoal infection. See, there are many protozoal infections, what you come across your routine curriculum. But please try to remember about two important protozoal infection. One is malaria. The other one is entamoeba histolytica infection. Now, when we talk about malarial infection, anti-malarial drugs are used. Sometimes they can ask you, write chemical classification of anti-malarial drugs in detail about chloroquine. Chloroquine is very popularly used anti-malarial drug where you should try to read what is the mechanism of action of chloroquine, what are the therapeutic uses of chloroquine, and what are the expected side effects of chloroquine. These are the three sectors of areas where you try to emphasize more on chloroquine. So try to focus more on chloroquine as an objective essay type of question in your examination. Coming to anti-amoebic drugs, other protozoal infection. Anti-amoebic drugs are nothing but drugs used for the treatment of entamoeba histolytica. Metronidazole, tenidazole, secnidazole are important drugs. So put a star mark on metronidazole because very commonly metronidazole is a broad spectrum anti-amoebic drug. So you should know about the mechanism of action, adverse drug reactions, and therapeutic uses of metronidazole. Being a broad spectrum anti-amoebic drug, it is used for aerobic, anaerobic bacterial infection, including most of the wide variety of protozoal infection. Is it clear? So from anti-amoebics, metronidazole should be highlighted. From anti-malarial drug, in detail about chloroquine mechanism, uses, ADR should be read. Now coming to ant-helminthic drug. You know very popularly most of the other parasitic infection. People who consume uncooked pork or contaminated fish or contaminated beef, they are more prone to develop helminthiasis. You don't have a specific classification for ant-helminthic drug. Very certainly, you are supposed to list out what are ant-helminthic drugs, such as albendazole, mebendazole, diethyl carbazane, praziquantel, pyrantel palmoate, levasimole. These are all ant-helminthic drugs. Now, out of all the drugs, what I have specified, you should know in detail about albendazole, which is used for all the pinworm, hookworm, roundworm infections. Secondly, very importantly, definitely you have to read about diethyl carbazane, which is a drug of choice for filariasis or elephantiasis. You should know about the adverse drug reactions of diethyl carbazane along with its therapeutic uses. So that covers in detail about drugs for the treatment of helminthic infestation. Maybe for 2 marks very specifically, they also ask you drugs for leishmaniasis or kala azar. So you should write only the drugs such as sodium stibogluconate, or even at times amphotericin is also used for leishmaniasis. So until and unless you remember the entire classification of the drug, then that will be quite easy for you to answer. 2 marks very specifically asked under each and every subset of drugs. They will ask you, name 4 anti-malarial drugs, name 4 anti-leprotic drug, name 4 drugs used to treat pulmonary tuberculosis. Or sometimes they will also ask you, name 4 fluoroquinolones used for urinary tract infections. So classification being very broad, you have to definitely read so that you can very specifically answer 2 marks question, which are quite scoring in your examination. Now coming to cancer chemotherapy. Now cancer chemotherapy can be tough to any nursing student to remember the vague set of 50 drugs into the classification. So I don't insist you all to go in detail into the classification of anti-cancer drug until and unless you should remember certain important points. Now students, try to remember the common toxicities of anti-cancer drugs such as alopecia, megaloblastic anemia, thrombocytopenia, bone marrow suppression, infertility in men, amenorrhea in women, and very commonly, nausea and vomiting. These common 8 adverse drug reaction to any cancer chemotherapeutic agent, you have to by heart. Now remember and try to listen very carefully. Out of all the 50 drugs from cancer chemotherapy, you have to specifically by heart, and you should know the basic points on Vinca alkaloids. Make a note of it. Vinca alkaloids, cisplatin, cyclophosphamide, methotrexate. These 4 drugs, Vinca alkaloids, cisplatin, cyclophosphamide, methotrexate. The mechanism of action and their important therapeutic uses. So that encompasses cancer chemotherapy. A very specific mechanism of action. What are all the cancer conditions they are used? Prostate carcinoma, carcinoma of breast, lung and liver cancers, head and neck cancers. Very specifically, you have to put answer in your answer script. Next, coming to immunosuppressant, immunostimulant. Now, here you should only remember two classical examples from immunosuppressants and immunostimulants. Name some immunosuppressant drugs such as corticosteroids. Clear? cycloserine, cyclosporin. That's it. You have to name the drugs. What are immunostimulants? Drugs which boost up the immune mechanism. Active immunization such as BCG vaccine can be immunostimulant. Thalidomide can be an immunostimulant. So here, only briefly you should know what are the examples of the drugs under stimulants and immunosuppressant. So as comes with ectoparasite, the same thing what I discussed with you, treatment of Kala-Azar or leishmaniasis, the same thing is covered under ectoparasite. So what are the expected essays over here? What they will ask you to classify penicillin antibiotics. You should know what are synthetic, what are natural penicillins, along with different examples. Then you should write the mechanism of action, uses and adverse effects of penicillin G. Put the heading as penicillin G. Mechanism of action. Penicillin G binds to bacterial cell wall and it inhibits the peptidoglycan of bacterial cell wall, thereby causing death of the bacteria. That's it. Simple mechanism. What are the uses of penicillin G? Very commonly, it is used for urinary tract infection. It is used for sexually transmitted diseases such as syphilis, gonorrhea. It is also very popularly used for most of the staphylococcal infections. That's it. Coming to adverse effects, any natural penicillins or penicillin G, if patient is sensitive, it leads to hypersensitivity reactions where it can cause anaphylaxis very commonly. So this is how you try to put very specific answers under the different side headings, whatever is being asked in your question paper. Similarly, very frequently from chemotherapy, as I told you, they will ask you, what are the drugs used in the treatment of tuberculosis? See, don't write in detail about tuberculosis, how it is caused, where it is caused, how it is contaminated. No, that is not the way you try to write. Just put the heading, first line drugs used for tuberculosis. What are the drugs? Isoniazid, rifampicin, ethambutol, pyrazinamide, streptomycin. That's it. Right mechanism of action, adverse effects of any two drugs. What I told you, isoniazid and very commonly rifampicin you can remember. What is the mechanism of isoniazid? Isoniazid enters into the bacterial cell wall and it inhibits the synthesis of mycolic acid of the bacteria. That's it. Coming to rifampicin, rifampicin enters the tuberculous bacteria and it inhibits RNA-dependent DNA polymerase enzyme. So when an evaluator sees these points, then he gets the concept. A nursing student have a wide knowledge about the answer so that you try to score good into the answer. Until and unless you write a brief history of tuberculosis, that is not going to help you out to pass in your examinations. Clear, students? Now next, coming to short notes. From most of the antibiotics and chemotherapy, you expect a short notes. From macrolide antibiotics, very commonly, if you see these macrolide antibiotics, what I told you, azithromycin, erythromycin, roxithromycin, you should enumerate them with a very basic focus of what is their expected mechanism and in what all streptococcal, staphylococcal infections they are used. You should try to write. They are used in the treatment of tonsillitis, pharyngitis, sore throat, gingivitis. You know, these are all the clinical conditions where you nurses should try to write point by point, one below the other. If you know the explanation, well and fine. If you don't know the explanation, don't write unnecessary points in the examination. Clear? Similarly, expected short notes can be from ciprofloxacin. Similarly, from cephalosporin. When they ask you the mechanism of ciprofloxacin, you should write ciprofloxacin It binds to bacterial DNA gyrase enzyme and it inhibits the bacterial DNA synthesis, thereby trying to be bacteriostatic agent. That's it. So that mentioning DNA gyrase in your answer will try to help you to score better marks. Coming to therapeutic uses of ciprofloxacin, yes, put it like it is used for the treatment of typhoid or enteric fever, complicated, uncomplicated UTI, for the treatment of syphilis, for the treatment of gonorrhea, for the treatment of anthrax. Enough. If you remember these 5 uses of ciprofloxacin, you can score very good marks. At least 4 marks out of 5 for short notes. Very commonly, if you see what I told you with very short essays, you should know the classification of a drugs to enumerate the drugs from each and every class, such as enumerate 4 anti-malarial drugs: chloroquine, primaquine, mefloquine, artheter, artemether. Enough. Similarly, write 2 therapeutic uses of albendazole. How do you write it for albendazole? First, try to recollect what is albendazole. It is used or it is classified under ant-helminthic drug. Then write down the uses. What are all the ant-helminthic infestation? Ascariasis, pinworm infection, hookworm infection. These are all helminthiasis infection where the drug of choice is albendazole. Similarly, what I told you, write 4 common toxicity of anti-cancer drug. You know very well. Any cancer patient on chemotherapy, what is the first side effect? Think immediately. Loss of hair, alopecia, then anemia, definitely write anemia. Then put it as thrombocytopenia, bone marrow depression, and out of which very popularly, blindly you should remember, nausea and vomiting is caused by any anti-cancer drug. So just put these 4 one word or one center answers for 2 marks. You will get full 2 on 2 marks for this. So this is how from chemotherapy and antibiotics, overall you have to correlate for your university session. Now, very importantly for drugs acting on GI. Now, students, this is very important topic where peptic ulcers should be covered, anti-emetic should be covered, laxatives and purgatives under constipation should be covered, and treatment of diarrhea. Okay, when you talk about peptic ulcer, you should know the classification of drugs used in peptic ulcer disease. And in detail, you should know about proton pump inhibitors. You should read about H2 blockers. And very, very importantly, anti-H. pylori drugs. That's it. These 3 group of drugs you have to remember from peptic ulcer. Now, some important tips for anti-emetic drugs. What are they all? They are used to prevent vomiting. So what are all these anti-emetic drugs? Metoclopramide-like drugs you have to remember. For constipation, laxatives and purgatives should be remembered. For treatment of diarrhea, student remember WHO ORS should be by hearted, along with anti-motility drugs should be read from the treatment of diarrhea. That is the main point of to be focused for your examination. See, expected essay can be drugs for peptic ulcer, mechanism of action and uses, ADRs of proton pump inhibitors, lansoprazole, pantoprazole, omeprazole, esomeprazole should be by hearted. Similarly, you should know how to classify anti-emetics with their mechanism and uses. At least you have to read in detail about metoclopramide. Coming to short notes, what are the drugs used for constipation? As I told you, laxatives and purgatives, and treatment of H. pylori. Sometimes in exam, they will ask you, what are anti-H. pylori? So there you should write the combination of WHO, like 1 tetracycline, 1 proton pump inhibitor, 1 H2 blocker. Coming to very short essays, at least you should know some anti-motility drugs used for diarrhea, such as loperamide, diphenoxylate, codeine. Such drugs you have to remember, and composition of WHO, ORS, sodium citrate, sodium bicarbonate, glucose. That simple combination should be remembered for 2 marks. So this is all overall view of GI. Coming to respiratory system, you have to read about drugs acting on asthma and drugs used for the treatment of cough, that is antitussive. So what questions you really try to expect? You should know the thorough classification of anti-asthmatic drugs. I know it's a very broad classification, but try to read very commonly about bronchodilators from the classification of anti-asthmatic drugs, salbutamol, terbinafine-like drugs. So you should know in detail about pharmacology of bronchodilators. Read about their mechanism of action, their uses, and specific adverse effects, where salbutamol has to be read very commonly. Coming to short essays, antitussive drugs, which are used for the treatment of cough. Centrally acting cough suppressant, morphine and codeine should be narrated with the examples. Coming to adverse effects of terbinafine, this is very commonly asked students. What are the 2 important ADRs of terbinafine? Terbinafine can cause delirium. It very well causes anxiety. It also causes tremors in a patient. Don't write nausea and vomiting. These 3 specific ADRs you have to remember. Similarly, if you see cromolyn sodium, it is specifically used to treat bronchial asthma. It is an immunoglobulin E antibody which is used to treat bronchial asthma. So that immunoglobulin E binding of cromolyn should be explained in the mechanism. Then how it causes bronchodilation in a patient. Similarly, coming to central nervous system and autonomic nervous system. Now, CNS, ANS are very vague. Now, let's discuss about central nervous system, where here you are going to learn very specifically about the drugs used for anesthesia. You should read about the local anesthetics, very importantly, lignocaine or xylocaine. Anti-epileptics classification. Phenytoin is a prototype of drug, students. Focus more on phenytoin. Then coming to analgesics and antipyretics. Classify non-steroidal anti-inflammatory drugs and make a golden rule of remembering aspirin in detail. Similarly, classification of sedative and hypnotics is very, very important, and in detail about morphine from opioids. From antipsychotic drugs, you have to read commonly about chlorpromazine. This is very important. From anti-manic drug, you have to read only about lithium carbonate. Antidepressants, please remember about selective serotonin reuptake inhibitors for your exam point of view. And anti-anxiety, you should remember at least 4 anti-anxiety drugs. What you are going to classify the same in sedative and hypnotics. Cholinergic drugs, you should know the classification. Acetylcholine and related drugs. Anticholinergics, you have to read in detail about classification and atropine. Again, very popularly and commonly asked question for nursing graduates. Skeletal muscle relaxants, you can try to skip, but still from skeletal muscle relaxants, you should try to read something about succinylcholine. It is very important drug. Anti-Parkinsonism is quite important, where you try to focus more on combination of levodopa and carbidopa from anti-Parkinsonism drugs. So what are the list of essay questions asked? You should know the classification of sedative and hypnotics, in detail about diazepam. It is used as skeletal muscle relaxant. It is used to treat epilepsy. It is also used to treat anxiety-related disorder. It is used to treat tetanus. These are the 4 important pharmacological properties of diazepam. Classify NSAID based on enzyme what they inhibit. COX inhibitor, selective, non-selective, in detail about aspirin. Aspirin has antiplatelet, anti-inflammatory. It has very, very well approached anti-analgesic property. Clear? Coming to antidepressants, what I told you, the classification is very important. Selective serotonin reuptake inhibitors, selective noradrenaline reuptake inhibitors, at least two drugs from each class you have to remember, and in detail about tricyclic antidepressants. Imipramine, amitriptyline are classical examples for tricyclic antidepressants, where you have to read about these 2 drugs, similarly followed by neuromuscular blockers. Don't get confused. Skeletal muscle relaxants are also known as neuromuscular blockers. So you should know the thorough classification of neuromuscular blockers and in detail about their mechanism and in detail about their different therapeutic uses, where adjuvant to general anesthesia, we try to put a patient on neuromuscular blockade. Short notes, they can ask you a direct question on carbamazepine, which is a very important anti-epileptic drug, which is also used for the treatment of trigeminal neuralgia. Similarly, you should also know something about monoamine oxidase inhibitors, which are used in the treatment of psychosis and depression. Sometimes they also ask you about the phases of general anesthesia. Phase 1, phase 2, phase 3, and phase 4. What are different general anesthetic agents used, such as nitrous oxide, halothane, isoflurane, L-furane? These are the drugs you're supposed to use. Remember, students, from general anesthesia, nitrous oxide can also be asked because it is commonly used as a laughing gas. Similarly, very short essay for 2 marks, valproic acid, anti-epileptic drug. What is its mechanism? Very specifically write it. It inhibits sodium channel ions in the brain, thereby preventing firing of the neurons. That's it. Adverse effects of buspirone, very commonly. It itself causes anxiety. It itself causes drowsiness and sedation. Naltrexone. What is naltrexone? You should recollect. Naltrexone is an opioid antagonist. It is used for the treatment of morphine overdose. This is how you try to correlate it. Similarly, mechanism of action and therapeutic uses of pseudostigmine, in which appropriate condition it is used. 2 specific uses with 1 mechanism of action. Coming to next unit, diuretics and cardiovascular system. Here, you should know drugs acting on kidney. Classification of diuretics. What are the drugs used for congestive heart failure? What are the drugs used for the treatment of hypertension? Very commonly, drugs used for the treatment of angina pectoris. Coming to drugs acting on blood, classification of oral anticoagulants such as warfarin should be read in detail. Enumerate fibrinolytics such as streptokinase, urokinase, altipase should be remembered. Hypolipidemic drugs can be an expected essay, with statins very popularly used. And coming to hematinics, students try to read on oral and parenteral iron preparation. Classification of antihypertensive, it consists of 10 group of drugs. You have to blindly classify and remember them. And very importantly, angiotensin converting enzyme inhibitors such as captopril, enalapril, lisinopril, perindopril like drugs should be remembered. Not only ACE inhibitors, here you should try to read also about calcium channel blockers for your university perspective. Next, classify hypolipidemic drugs, statins, fibrates, niacin. All these drugs should be classified in detail about statins, because statins are frequently used to treat dyslipidemia. Whenever there is increased triglyceride level, cholesterol level, LDL, VLDL, there you go for statin. So that pharmacology should be read in detail. Similarly, what I told you, short note on calcium channel blockers. If they ask you direct question, what are short note on calcium channel blockers? What are you going to do? You're going to write the drugs under this category: verapamil, diltiazem, nifedipine-like drugs. Then write their brief mechanism, followed by immediate therapeutic uses. They are used to treat hypertension, to treat angina pectoris, to treat myocardial infarction. Similarly, very short notes. For example, if they ask you two adverse effects of quinidine, think quinidine. Quinidine is classified under arrhythmia. It is used for the treatment of arrhythmias. The same quinidine from quinine is also used for the treatment of malaria. So that is how you remember the uses. So quinidine, which is used to treat arrhythmia, it itself can cause dysarrhythmia. Quinidine is an alkaloid, so it can be bitter in taste. It can cause nausea and vomiting. So put that very precisely. Similarly, you should also remember examples of drug under antihypertensive. What they have asked you here, give examples for non-selective beta blockers. For example, if you see propranolol, it is a non-selective beta blocker. Etinolol, timolol, such drugs should be by-hearted for a very precise 2 marks. Similarly, coming to 7th unit, vaccines, vitamins, and minerals. Here you need not work that much hard, students. For vaccines, you should know the classification of live attenuated, killed vaccines from both virus as well as bacteria. Try to learn the examples of vaccines. Similarly, you should know in short about vitamins. Vitamins you have been learning from your first year course from biochemistry. So here you should know the therapeutic uses of important vitamins like vitamin A, vitamin B12, folic acid, very exclusively for 2 marks and for short essay. For example, classify vaccines. They are live, they are killed both from bacteria as well as virus and toxins. A short note on BCG vaccine. How prophylactically, through what route, at what age it is given, you have to mention these specific points. Then coming to very short note, you have to elaborate 2 marks answers with specific therapeutic uses on vitamin D, used for rickets, uses of folic acid in pregnancy in lactating women, uses of vitamin B12 used in megaloblastic anemia, including iron deficiency anemia. Then you should know what are vitamin A analogs with its 2 important specific uses. So vitamins, just try to focus on therapeutic uses of vitamins. You need not go in depth of the vitamins mechanism, but the conditions where you are going to use for 2 marks, you should definitely by heart. Coming to hormonal drug, again, it is very vague topic. Only important points you should remember from hormonal drugs is you should focus on prostaglandins. They are popularly used in obs and gynae. The drugs under this category, misoprostol, enprostol, carbopros, that you have to remember. Similarly, you should know oral hypoglycemics for the treatment of type 2 diabetes, and very importantly, students, what are the methods of hormonal contraception, including oxytocin in detail. For example, they will ask you very commonly to classify oral hypoglycemic based upon the chemical classification. If you see all the oral hypoglycemic, metformin is very commonly used in type 2 diabetes. So detailed pharmacology. What do you write for detailed pharmacology of metformin? Its mechanism of action, its therapeutic uses, and its adverse effects. That's it. Similarly, you should know something known as SERMs, selective estrogen receptor modulators, where clomiphene citrate, it is an important drug used for ovulation inducing agent. So that point you have to specify when you write clomiphene citrate. Try to read more on classification of anti-thyroid drugs, preparations of insulin with only their therapeutic uses, and methods of oral contraceptives. You know, hormonal contraceptive methods are given in most of the textbooks. So mini pill, biphasic pill, triphasic pill, with different examples you have to remember. For very short essay, focus on uses of anabolic steroids, at least 2 uses, 4 adverse effects of corticosteroids like Cushing syndrome, buffalo hum, diabetes mellitus. Such answers should be written. You should know calcium preparations, calcium gluconate, calcium lactate, all such preparations. Then prostaglandin analogs, what I have already discussed. Coming to toxicology, in toxicology, you need not read anything that much confined, because every unit you will be reading about the treatment of poisoning. From ANS, you will read about atropine poisoning, organophosphorus poisoning. So you should remember antidotes for these poisoning for your exam point of view. Coming to heavy metal intoxication, chelating agents are very, very important. You should read about British anti-lewisite, dimercaprol, how you are going to treat iron poisoning, how you are going to treat copper poisoning. Clear? All the drugs used for heavy metal toxicity are chelating agent, where you try to focus for short essays on BAL, British anti-lewisite, penicillamine, which is used for copper poisoning, dimercaprol for mercury, copper poisoning, and iron poisoning treatment. You should remember specific antidote or antagonist such as desferrioxime or defiripone. Coming to dermatology, ear, nose, and eye, very exclusively. You need not go in detail over here. When it comes to these topics, remember, you should know only the drugs used to treat glaucoma. Glaucoma is a disease of eye. Miotics are used to treat glaucoma. So enlist the drugs: pilocarpine, beta blockers, cholinomimetic drugs, or diuretics. That's it. 4 group of drugs used to treat glaucoma. Drugs for nasal diseases, nasal decongestants. If you remember the classification of adrenergic drugs, xylometazoline, oxometazoline, such drugs can be kept as nasal decongestant. Then you should know what are the antibiotics used for skin and soft tissue infection. What already you will be learning it in antibiotics. What I told you, fluoroquinolones, cephalosporins, Very popularly, read 4 of them, which are used to treat skin and soft tissue infection. Yes, exclusively they can ask you for the treatment of pediculosis and scabies. Drugs such as ivermectin, permethrin, sulfur. These 3 drugs you have to read it for pediculosis as well as for scabies. So overall, if you see your university question paper, you have to be well prepared for 13 marks question. Major scoring in pharmacology is done from the essay, because your essay will be divided into different section where it is a structured essay. For example, they have asked you to define CHF. Definition carries 2 marks. Then you are supposed to classify the group of drugs such as diuretics, beta blockers, vasodilators. At least if you mention these major headings with 2 drugs, you can score at least 7 marks in the classification. Rest of the marks will be a note on digitalis. What is digitalis? It is used to treat CHF. So write down its mechanism of action, its pharmacodynamics, therapeutic uses, and adverse drug reactions very precisely. Don't keep on explaining about digitalis in detail. No, nobody is bothered about that. Answer to the point. Check the division of the marks, put it in your mind, and what is required, only that information should be written for 13 marks. Coming to 5 marks. 5 marks questions can be direct questions. For example, if you see over here, they asked you about laxatives. What are laxatives? You should know they are the drugs used for the treatment of constipation. So write down the drugs. If you remember the classification, it is well and good. Liquid paraffin, castor oil, senna, magnesium sulfate, magnesium chloride. Write down the list of the drugs. Then put therapeutic uses. Laxatives are used to treat constipation. They are given in bedridden patients. They are used diagnostically for colonoscopy before endoscopy. This is how you try to recollect and put it one below the other in detail in a point-wise manner. Similarly, if you see, they are asking about something known as drug antagonism from general pharmacology. What is antagonism? One drug inhibits the action of other. Then you classify antagonism. It can be physical, it can be chemical, it can be physiological, it can be receptor related, where in each and every class put 1 or 2 examples. That's it. That is how you try to answer 5 marks questions. Now 2 marks are very precise, students. Trust me, if you by heart specific uses of prototype of drugs, whatever I have discussed, you will get 2 on 2. Uses of H2 antihistaminics. Simple way. They are used to treat allergy, allergic rhinitis, hay fever, ectopic dermatitis. That's it. 2 uses. Similarly, any 2 adverse effects of antihistamine. You take cetirizine. When you try to recollect antihistaminic, you will think about cetirizine. So what happens when you take cetirizine? Sedation, drowsiness, enough. 2 adverse effects. Similarly, here, if you see, enlist cholinergic receptors. The last question which is asked. Remember, what are cholinergic receptors? They bind to cholinergic drugs, bind to cholinergic receptor. So remember them as nicotinic receptors, muscarinic receptors. Again, muscarinic are M1, M2, M3. That's it. If you write nicotinic, muscarinic, you will get full 2 marks. So that is how precisely, specifically, and specificity you try to answer 2 marks question. So this is the pattern of your examination. Pharmacology is always covered with pathology and genetics. And if you really see, the major portion of marks are allotted for pharmacology with 38, where at least you have to score 20 marks to pass. If you don't score 20, You're going to flunk even in pathology and genetics. Again, you have to reappear. And lucky that you are going to get an option. You have a you have a what do you say, option to choose any one essay. So this is a structured essay where they are dividing you the marks. You can see classify antihypertensive drugs, 4 marks. At least out of 10 classes, if you try to write 7 classes with 2 example, you will try to secure at least 2.5 marks. Mechanism of action is 2 marks. Adverse effects is 3 marks. Uses of enalapril are 4 marks. So just look into this division, put the side heading and answer specific to the point with that clinical condition instead of writing vague stories. Out of 13, at least you can try to score 8 marks for an essay question. If you see short note, out of 5, you are supposed to answer only 3. You can see very specifically they are asking uses of aspirin, analgesic, antipyretic, anti-inflammatory. 3 uses with conditions you have to write. That's it. They're asking you a short note on bronchodilators. Isn't it easy? Enumerate bronchodilators. What are they? Beta-2 agonist, salbutamol, terbinafine, salmeterol. Similarly, methylxanthines, they are bronchodilators. Corticosteroids, they are bronchodilators. Write down the classification, write therapeutic uses. You will definitely get 4 marks. Similarly, they are asking oral anticoagulants. Only oral drugs you have to classify. Warfarin, apixaban. These are all oral anticoagulant. So that is how specifically you write. Now, students, if you try to look over here, they have asked you one direct drug for short essay. What is that? Omeprazole. So put the heading as omeprazole. Try to recollect omeprazole belongs to which group? Oh, omeprazole is used to treat peptic ulcer. So it is, it comes under the category of proton pump inhibitor. So, right, it is a proton pump inhibitor. So when I, as an evaluator, look at your answer, yes, I go happy. You have a general concept. It belongs to PPI. Then I try to give you 1 mark over them. Then write down its therapeutic uses. It is used for peptic ulcer, gastric ulcer, duodenal ulcer, stress-induced ulcer. If you write this, you will get more 2 marks. 2 plus 1, 3. Write down its adverse effects. Then you will try to get at least 1 mark over there. So this is how 4 marks maximum you can score out of 5. Then lastly, coming to the brief answer. What we have discussed for last, almost more than 1 hour, all the very short notes should be answered very precisely and very briefly, where you should know the thorough classification of all the group of drugs. So this is the overall pattern of your question paper. Now, students, I hope I have tried to do justice to most of the tips what you're supposed to put in your answer papers. Clear? So here, for more detail and more information, you can try to log into the Prakara Potential Realized. This is exclusively, especially if you see for first year curriculum or very well for BSc nursing students, Prakara is really trying to help out the students, and they are coming with better and better options with very good features on different video lecturing, on different students' notes. They are also trying to help the students with the key term and self-assessment. Trust me, student, self-assessment from Prakara is going to raise a confidence level in the student. So, you for every semester, it's something like only rupees 149 a student has to purchase it. And the trial is valid for only 21 days, where you try to get a generalized overview concept of your nursing subject. I hope it was quite clear. Definitely, the session was quite informative. How to put pharmacology on your answer script. So thank you so much for this opportunity and wish you all the best for your examination. Read well, do well, because most of the patients are reliable on the nurses. And specifically when it comes to pharmacology, you're not supposed to ignore the drugs. Till the end of your last breath, you have to be reliable on pharmacology of drugs. So thank you so much.